that is unprejudiced observer. One more important question comes from this aphorism, that is nothing but portrait of disease. So, portrait of disease. This can come as an essay question as well as a short note. Now when I say about portrait, a thought always comes in my mind, that is Leonardo da Vinci's painting of Mona Lisa. Now the beauty, I have not seen the painting myself but heard a lot about it, that if you stand anywhere in the room, you always feel that she is watching you. Just imagine a lady always watching you. Okay, so but the point is, what is a portrait? Portrait is representation of a person. The definition of portrait is representation of a person, especially the face. It also means graphic description. Now, what does a portrait of disease mean? This representation of patients, all signs and symptoms in its whole extent. So, what are the things you need to form a portrait of a disease, or what are the things a physician needs to form a portrait of the disease? So, we will take what are the qualities a physician should possess. Qualities of physician. So, one quality, most important quality is the physician should be a unprejudiced observer. Second, he should have keen observation of all signs and symptoms of the patient. Third, he should note three things, all which is told by the patient, observation of the physician himself, and observation of the physician himself, all that is told by the patient, and the things which are remarked by the people around him. So, these are the three things. Then the fourth thing is, he should have keen senses. As I already told you, observation starts from the time the patient enters your room. Keen senses mean everything, like he should have a good nose so that he can find if the patient is having offensive sweat or offensive smell of urine or whatever you are seeing in the patient, you should be able to observe it better. Okay. So, these are the qualities a physician should possess to make a portrait of the disease. Then let's go to what other things, that is, what knowledge a physician should have. We have already discussed this, that a knowledge physician should possess in order to make portrait of the disease in the third aphorism. I will not be repeating it, but you just have to explain it. Knowledge of physician. We have already covered it in aphorism third. Of course, there are 8 knowledges. Then we tell what is the classification of symptoms by Hahnemann. In this aphorism, Hahnemann divides the symptoms into 2 types, that is subjective, where he tells it a physician should note all the things which are signs and symptoms or deviations which are expressed by the patient, that is subjective, which is felt by the patient, and objective symptoms which are reported by the people, remarked by people around the patient or the bystanders or relatives, and observed by physician. What is further you add to portrait of disease? That is, portrait of disease means nothing else but totality of symptoms. That's what I meant, that all the signs and symptoms in its whole extent put together form the portrait of disease or the totality of symptoms. When I will be taking a class on totality of symptoms, of course that time you will be able to understand Hahnemann's view and many other authors' view that time. But here I am just giving a gist so that you can write this answer better if this question is asked. Of course, you can merge those answers here also. So, classification of symptoms by Hahnemann, how he has explained in this aphorism. Then, what is totality of symptoms? TOS means totality of symptoms. That is, all signs and symptoms in its whole extent together form the portrait of the disease. So with this, our portrait of disease is over. Now I just gave you very few points. Then how will you write this question if it comes in your exam for essay type, like 15 marks or 10 marks or 20 marks? What you do is that you just stretch all the things which I have told you. Like when you explain about quality of physician, you explain unprejudiced observer, or which I have told under unprejudiced observer, you write in detail. And when you tell about knowledge of physician, you write all the 8 knowledges and explain it 1 or 2 lines so that the answer becomes lengthy enough for you to write as an essay. The same way you tell about classification of symptoms by Hahnemann, and then you tell about totality of symptoms, as I now itself I told you that it will be explained in a different class. So all this together you can write it in 1 page or you can write it in 4 or 5 pages. Depends on the marks allotted to that particular question. I think you have understood this better. If any doubts, you can always put it in the comment section so that I can answer up clear your queries. So with this, today's class is over. Thank you and stay tuned for more.